Saad, you described and we've talked so far about the complexities, why it's difficult. You know, we've gone over the reasons it's challenging. Do you feel like you've got some best practices as a CIO that after grappling with this, that you feel like you've got a methodology or a way forward to deal with these difficulties, or is it still feel like a work in progress?
I think the best practices around this really do develop from one organization to the next. And part of that is because some of those will lie in your partnership with organizations like 314E. So if you have an organization that you're working with to have an archival solution in place, over time, the people at that vendor and at your organization will come to a standard operating procedure. Hey, we're buying a new facility. Hey, their previous EHR was XYZ. Oh yeah, we archived one of those before. So let's get on with the data transformation and analysis initially, and then we'll get them into the same exact kind of archiving solution that we've had in the past. The trick around this, from my perspective, the learning for me was to just be comfortable that that initial analysis will output a level of custom work. Sometimes it'll be repetition if you've done a lot of archiving in the past, but there will be something unique. And I have come across every single one of these. There's going to be something unique about each one that you do. And you just have to be open to saying that, okay, we'll just have to figure a way around it. We're just going to have to figure a way to approach it and then add it to our, if you have a single repository for archiving or multiple ones. So it's just being comfortable with the idea that there's not going to be a one-hit wonder sort of status. As soon as you know upfront that you're about to buy a hospital or a facility or sunsetting an application, you'll know exactly what you need to do with that data and how it needs to be transformed for the archive.